Hi, my name is Dave Feely. I'm a senior therapist at Oxford Physical Therapy in our Florence Center location, and this is Brett Laynard. He's an athletic trainer with us as well. Today we're going to talk about some common shoulder injuries and injury prevention. The two main common shoulder injuries are rotator cuff strains and overhead impingement. The muscles of the rotator cuff and the bones of the rotator cuff are pretty simple. You've got your three main bones, your clavicle, which sits right in the front, your scapula, which sits in the back of your shoulder, and your humerus, which is your arm bone right here. The four main muscles of the rotator cuff are the supraspinatus, sits on top, allows with external rotation and overhead lifting, your infraspinatus, your teres minor, and your subscapularis that also help with rotation and overhead lifting. Some of the main common injuries, the reasons for injuries for shoulder impingement or a rotator cuff strain are heavy overhead lifting or lifting heavy out to the side. Okay, so some common ways to prevent injury are to work some of the smaller muscles. These include your internal and external rotators, your scapular protractors, and your scapular retractors. And Brett here is going to demonstrate some of these for us. To start, we're going to start with your scapular protractors. Basically, you're going to start with your arms straight, and you're going to go ahead and protract your scapula, working your serratus anterior, just like that. Next, we're going to work our internal and external rotators. For your external rotation, you're going to work just here, our elbow at 90 degrees, rotating out. And then to turn around, then you're going to do your internal rotators, rotating in. Elbow stays at 90 degrees, scapula in good scapular position. Finally, we're going to come on over here to the rows. Basically, you're going to stand just like this, stoop back just a little bit. You're going to go ahead and retract both scapulas back, good shoulder position, and scapula working your scapular retractors. A big reason for some of the common shoulder injuries is because people work some of the big muscle groups like their chest and their lats, but they don't work some of the smaller parascapular muscles in the shoulder. For injury prevention, if you want to learn more about injury prevention, visit one of our local Oxford Physical Therapy sites, or visit us at oxfordphysicaltherapy.com or follow us on Twitter.